Hi, guys.
Hey, guys.
Okay, so here it is, March 14th, 2 days before my birthday. I'll be 45 in 2 days.
Oh.
And we're on day 35 of me finding out on this wonderful journey.
Tulip journey. Tulip journey.
Tulip journey. So, you've kind of seen some updates, but we're just going to, kind of clarify some things, what happened. So this Monday of this week, I went in, it was scheduled time to go in, and we were hoping that all my tubes would come out. So we did find out that, while I was there, they took all the tubes out, which was really, really good. I was so excited to
It was awful. The tubes are like 18 inches inside of her body.
I swear he was going to pass out.
No, I wasn't going to pass out. I thought they were like 4 inches in her body. And when they went to pull the 2 out of the right side and it kept going, my mouth was open, my eyes were open. The doctor thought I was going to pass out. And I was just astonished that they were in. I mean, all the way down. It looked like they pulled out intestine, so much of it. And then they pulled out the other side.
Yeah. It didn't hurt coming out. It hurt more
Hurt me.
Hurt more her taking out the stitch than it did, pulling the tube out, which was okay. So we leave the office. Everything seemed fine, and we go run some errands. We went to eat lunch. We went by Target. I got to pick up some new bandos, to wear, since I didn't really have to worry about wearing a bra.
I didn't know what those were.
And so we get back to Brian's office, and I'm sitting back in his recliner in his office, his white recliner.
White recliner.
And I'm texting another girl who's going through the same thing. She's having surgery here at the end of this month. Oh, no, beginning of next month. And so I was telling her about some things, and all of a sudden I felt like, well, my my chemo port that's right here started hurting. And then I started feeling something running down my left side. And so I get up out of the chair, and I had, put my hand underneath my shirt and came back out, and it was just full of blood.
She looked like a gunshot victim.
Yeah, so I walked out to the hallway to Brian, and
I was in the office next door. We were having a little bit of a powwow, and
he freaked out.
I don't know if I'd say freaked out. There was just, again, when your loved one looks like she got shot, and we can't explain what's going on, so we went back to Dr. Vogue's office. We called, and we went back over there, and she looked at it, and because of all the blood had filled basically my whole spacer. About double that size, yeah.
And it was so hard. Even though it had stopped bleeding, she was really afraid.
Which she didn't know it stopped bleeding on the inside.
Right.
It stopped leaking out of her.
Right. She was really afraid that, for one, that I couldn't feel my chemo port anymore, and that it wouldn't go down or go away. So she decided right then that I was going to go in and have emergency surgery done.
Right, and so from the time she said, hey, emergency surgery, until Heidi was in the room, it was about an hour. It was fast.
Yeah.
It was fast moving, and once they got her under the knife, they started at 6:01. It took about 45 minutes, and they were out. And we're not going to name the hospital, but it was disgusting.
Yeah, it wasn't
terrible.
very good.
It was dirty.
Yeah.
So the doctor said that, hey, if she feels up to it, you can get her home tonight and sleep in her own bed. If not, she can stay overnight. Well, we made the decision for a couple of reasons, mainly because of the filth that we needed to get her out of there.
It was, and it...
She has a tube back in.
I know.
So she has to...
I have a tube back in.
She's like a teenage child. She can't be left unattended.
That's okay. I have one. It's better than, than having them all back in. But I will say this one hurt more. This surgery hurt more than my first surgery. And I think it was just because they had to go back in and cut on the same spot.
Yeah, well, yeah. You're healed up, and you're 10 days into healing, and, and you got to cut back into the same area, just on the left side, so they didn't have to go in both.
Just the left. So it, Monday and Tuesday, it was rough. It was really rough.
It was. You were a lot more sensitive, and again, you're tough.
Yeah.
But now you're good. You're just
getting
down to taking pain relief just when you're sleeping, which is better. So
because I was happy to be off of it. So.
Yeah, but having the pain relief when you're sleeping helps you relax and helps you heal better. So I know you don't want to be on it. But,
So yeah. So anyway.
But we have good news.
Several things.
Yeah.
So first I got, I heard back about my genetic testing, which happened to come back negative.
Negative, right.
So the girls don't have to worry about anything.
But the first thing Jade said, little bird, she says, shit, I don't get free tits. So I don't know what her deal is. And when a 19-year-old is, I mean, we got a whole nother set of issues with her, and she'll watch and she knows what I'm talking. Yeah, well, that's yeah.
So
yeah, so it's good. It was positive. I mean, the girls, they haven't been freaked out about the genetic results. Like, it is what it is.
Yeah.
So, but yeah, it's kind of nice to know that those were negative,
yep.
and so you haven't poisoned our children.
Nope.
Nope.
No.
So,
no, not so far.
not so far.
No.
Just mentally. We've
and I'll have to show pictures later, but I got a new car. So
she did, and she bled out in it. That was
no, I didn't.
We were test driving that car.
We were test driving it Monday, and we were supposed to have it overnight, and I was really worried about getting blood in it when we went
But
back
she
to
wasn't worried about my white furniture in my
no,
office.
I was.
Which we got cleaned up.
Yeah.
So she was worried about it.
Yeah.
But at the end of that didn't matter. It cleaned up pretty nicely.
Yeah.
So
So I got a Hyundai Tucson, and it's pearl white, and it's really cute.
Yeah, it's
It's
good.
nice,
It's good.
yeah.
And it was nice. We did a lot of the stuff while she was in the hospital. I called and gave her all the information over the phone, and we said, hey, we're coming in with a checkbook, and don't mess with us, and don't try to sell us all the add-ons. And
Yeah.
man, we were out there in 15 minutes. So
Yeah.
Hatchet Hyundai, you guys did a good job.
Yeah, it was good. So basically all we have left is, well, to tell you is that, of course, Monday I go in and see Cusick, who was the surgeon, and then we see Deitch, the oncologist, who we will find out what roughly the plan is.
And we'll probably be pushed back if we decide to do any chemo. We'll probably be pushed back at least 10 days because we've got to get
surgery.
yeah, because of the second surgery. So
That's
again,
about
about
it.
10 days behind. But again, I guess it could be worse. I mean, you hate when you have to have an emergency surgery. That kind of sucks. And we've had a pretty smooth path so far.
Yeah.
And I guess the first hiccups is to remind us that we're not in control.
Yeah. Nope.
So
God's plan.
But we got to get away a little bit.
Yes,
so
you
we
see?
came down. We came down to the lake.
Yep.
So that's kind of
nice.
nice since she can't be left alone again. She's like a teenage kid with alcohol around, so you've got to be around her all the time.
Yeah.
So, but otherwise,
Yeah. That's it.
on
Well,
track-ish.
Yeah, and I know it's Friday, but we'll update everybody again Monday what goes on with the doctor's
Today's
appointment.
Thursday. She
Oh,
told you it's the
shit.
14th. She has trouble with that.
Yeah, I've lost track
Yeah.
of days. I just know in 2 days it's my birthday, so I don't care. Yeah.
All right. Is that all?
Yeah, that's it. Okay.
Okay, bye.
We'll talk to you guys
All right,
Monday.
thanks.
Bye.